At 2, she collapsed on the kitchen floor. Years later, she showed off her backstroke and woke up on the concrete, 30 faces staring down. Some days she went from the emergency room to classroom by morning. No one saw the nights. Living between chronic and terminal can make time feel sharp. It also makes courage a habit. Meet Dishita.
And CPR through the phone, through 911, and they didn't know if I was going to be alive or not. Diagnosis called triadin-knockout syndrome. It's a very rare sudden cardiac arrest. It's the type of condition where you don't know. Like cancer, you kind of have a terminal date, you know, like something's coming. This, you could like live a super long, healthy life, or you could have a cardiac arrest, no one's around you, and you die. When I was in the ambulance, I lost my heartbeat again. If you've already beat nature so many times, like what other limit could there possibly be? How many people have been through like life or death experiences multiple times over? And like the amount of grief that comes with that, the amount of pain, the amount of effort I have to put in to pick myself up every single time and like do the healing work, because no one, at the end of the day, no one else knows what it's like. So the only person who can actually like save myself is me. I'd go to the hospital and then the next day I'd go back to school like nothing ever happened. I felt like I had a relatively normal childhood because I never let myself feel like anything was wrong. No, that was amazing. I think the only thing to add is like outside of all the work that I do, I also do fun things like painting and writing. Really into pop culture, maybe too much, but yeah.
So, I'd love to begin. You described being 2 years old, playing with your twin, and suddenly collapsing, or showing off your backstroke and then lying on the concrete with your limbs burning. Can you take us back to that moment?
Yeah, so I don't really remember the first one because I was 2 years old, but the second one I do remember because I was swimming and then all of a sudden my head started pounding, and I felt myself losing consciousness almost. Like I genuinely do remember being in the water and not knowing what was happening, and then the next thing I know, I'm on the floor next to the pool, like on a bathing towel, just in my bathing suit, and there's about 30 people just staring down at me. A lot of my classmates who I went to preschool with, and my mom's crying. Then the ambulance people didn't come for a while. I wasn't even crying at that point. I was just like, what's going on? Like, I don't understand.
From all of that, do you feel as if there were experiences from your childhood that you started grieving from that early age?
I don't know. I kind of disassociated most times I had cardiac arrest. So like they would happen, it would be a terrible day. I'd go to the hospital and then the next day I'd go back to school like nothing ever happened. And I felt like I had a relatively normal childhood because I never let myself feel like anything was wrong.
Do you think the people around you understood the weight of those losses at the time?
By people, if you mean my classmates, like we were only 5 or 6 years old. So like I remember one friend would be like, is your heart okay? And that's kind of like the extent of their understanding of what was going on. I went back to class, like no one really knew what happened the night before, because a cardiac arrest is like, it happens to you and then you're back to normal. And I know like my friends knew I would pass out at times and things like that, but no one really saw it happening. I mean, other than people who were at the swimming pool.
What about your family?
I definitely think it traumatized them more than it traumatized me. I mean, I remember what they told me about the first time when I was 2 years old. They didn't know what a cardiac arrest was, and they didn't even know what CPR was. So they learned CPR through the phone, through 911, and they didn't know if I was going to be alive or not. And then I woke up again, but when I was in the ambulance, I lost my heartbeat again. So like they didn't know what was going on.
So for our listeners who might not know, do you mind sharing a little bit more about your diagnosis and what it means for your everyday life?
Yeah. So I have a diagnosis called triadin-knockout syndrome. It's a very rare sudden cardiac arrest syndrome that's also connected to muscular myopathy, which is just generalized muscle weakness and atrophy or muscular atrophy, so sometimes like my muscles are generally weaker than the general adult or just average person. And then on top of that, I do have like comorbidities like hypermobility and PCOS, but altogether I think how they present in every day is like chronic fatigue, chronic pain all the time. Because of the cardiac arrest, I've had a few brain injuries because like you lose oxygen to your brain every time you have a cardiac arrest. And then also if you fall, you hit your head really hard. So I've had multiple brain injuries, so that also sometimes causes like brain fog and things like that I have to navigate.
You've written, "It's strange to know the cause of your death at age 18, to inhabit a space between chronic and terminal. How has living with that knowledge shaped the way you move through life?"
It's both good and bad in a way. The good is that it's given me like this strong urgency and compulsion to live every moment like it's like the last moment. So especially like how this shows up academically and career-wise is like I'm really not afraid to do like big bold things. When I reached out to the North Carolina Department of Health, it was just like a moment of anger, and I was like, I want to reach out to whoever I can, and like the biggest person possible was to go beyond my school and go to the State Department. So like things like that, I just like don't really put limits on myself, because like if you've already beat nature so many times, like what other limit could there possibly be? But I mean, it's definitely really hard because there's also death looming over you at all times, and like I have all the precautions, all the preventions, but it's the type of condition where you don't know. Like cancer, you kind of have a terminal date, you know, like something's coming. This, you could like live a super long healthy life, or you could have a cardiac arrest, no one's around you and you die, you know what I mean? So that definitely, I don't think about it a lot, because if you think about it, like I can't really do anything about it, but it's definitely like, it definitely makes me feel very isolated from everyone else around me, my family, like no one can understand it, you know? So
it's amazing that you're trying to live your life to the fullest. I feel like there are so many people who aren't able to do that. But do you ever ask yourself, why me? Why has this happened to me?
I would say yes, many, many times. Like, especially in the last year, I had 4 surgeries. I had a cardiac arrest, and the cardiac arrest led to a traumatic brain injury. And I was applying to colleges at the same time. I was doing my college interviews concussed, and then I entered college. And like, college is the only thing that's kept me going through school, like that motivation to get into a good college. Like whenever anything else was happening, I was like, I really like, school is my one thing. And so like to have all that happening while I was applying to college, I couldn't even apply to the schools I really wanted to go to. And then I got into a school in New York City that I really wanted to go to, but I couldn't because I had surgery, so I had to stay at Duke. So like those type of things, it's like you put all your heart and soul into school, and then like in the end, my health still gets in the way. So like that's when I start asking those type of questions.
Dishita, you are incredible. You've been through so much and you're so resilient. In those difficult times, what do you do to stay grounded?
I don't know what I would say to stay grounded. I think I've always had a very like deep conviction since I was a little child. Like there must be a reason why this is happening to me. Like in a good way, like I am capable of handling all this. I have the emotional maturity, I have the intelligence, I have the intuitiveness. I'm empathetic. I understand what it means to suffer, and I understand other people's suffering is really bad too. And so I can handle it, and I can also like translate it into something good and impactful when I want to. So I've always like known that even when things are happening to me, it will become a story eventually that other people can benefit from.
That is a beautiful way of looking at it, and I really do want to commend you, because again, it takes so much strength to have that perspective, because I've never been in your shoes. I don't know if I would be as resilient. I can't say it enough. You are incredible.
Thank you.
You touched on this a little, but if other people were to get this diagnosis, their reaction might be slightly different, right? Like maybe they want to go travel the world, do as much as they can, but what has been different for you in terms of you wanting to pursue advocacy and really help other people and patients around the world?
Well, the one big difference is I was diagnosed, or like I had it since I was a child. I never had like I didn't know any different than like sickness. And so like the only way to or cope through that or move through that is just to keep moving and keep doing what I have to do. If we're going outside of the medical context, I grew up in an immigrant household. We always value education, we value like career ambition, all of that. And so like that's not like, that's still there, it's very present, it's still a very big value of mine. I know it makes me stand out because like genuinely, like if I'm ever talking to a career professional or anything, like automatically we connect over the fact that I'm so authentic because I like come from a place of like knowing like the like deep and like intimate parts of being human, and so like it's not, none of my interactions are ever superficial.
Why have you decided to pursue advocacy and helping patients?
Yeah, I just think I wanna actually do good, and I think that's just been a value of mine since I was young, is to, because also like when you're in the hospital, there's so many other child patients who can't leave, and especially with my condition, like as I said, you can die at any time. So there's probably people who've had it and died at a young age. So there's a lot of privilege that I hold, just being alive, and I want to use that for like something good.
I'd love to follow up on something you just said. You said, you know what it's like to be deeply human. Can you elaborate on that?
Yeah, I think like a lot of my peers maybe move through space and time, sort of like not ever having to get to like the pits or like extreme highs, or like they're kind of just like go. I don't know how many people have been through like life or death experiences multiple times over, and like the amount of grief that comes with that, the amount of pain, the amount of effort I have to put in to pick myself up every single time and like do the healing work, because no one, at the end of the day, no one else knows what it's like. So the only person who can actually like save myself is me. And so going through all of those emotions, that's like a lot you have to process and understand. And especially since it's been happening since I was 2 years old, like I've always just been in my head all the time. Yeah.
As you know, most of our audience is pre-health oriented, but a high percentage start off as pre-med. What role do you think doctors should play in preparing patients for the emotional weight of a diagnosis?
If I'm only speaking from the child patient perspective, I think you shouldn't assume that children can't handle it. Like they know their condition better than you do as a doctor, because especially a child patient who's been through a lot themselves, they're mature, they're very intelligent. Just to be in school, you have to make so many like DIY hacks, you have to like figure everything out. Don't like try to sugarcoat anything or like make it softer for the patient. Just lay it all out, and then after, when they have the emotional reaction or whatever it is, like just be there to like give a hug or something like that, just like, or let them process it. But I think like a lot of doctors, in my experience, just come in with their own assumptions of how I will react, how I will process, and then it doesn't land well. So just go in with no assumptions.
What does that look like tangibly? Is that asking you questions first, and maybe what questions do you wish you were asked?
I had one physical therapist this past summer who was really good. She asked me very specific questions, and every time I gave a question, she would continue to follow up with more until I felt like completely comfortable telling her every single symptom, every single way it felt, because nothing felt off limits, nothing felt like I was going in the wrong direction. And then after, she would be like, wow, that's really hard for you to go through at such a young age. I can't imagine going through all of that, and like you've been through a lot. And even though this is a physical therapy appointment, like if you want to talk to me about mental health or like anything you're going through, like I will make space for you. And so I just felt like that, just like saying that it means a lot.
You've said in the past that a lot of doctors you have visited have basically had one hand on the door, right?
Yeah.
They're just like ready to go and leave. And so clearly that miscommunication can really grow and grow. And so what do you feel that miscommunication has cost you throughout your life?
I would actually say, like, even right now, I am very underdiagnosed in a way. Like, I am mainly only treated for my heart condition when there's a lot of other symptoms going on. And it's because when I see the doctor, they only talk about one part of me, which is my health, my heart, and like whatever's going on with my heart. Or if I'm seeing the neurosurgeon or whatever, they're only talking about the brain. And no one's talking about how it's all connected. And for me to be like, yeah, well, my heart is acting up, but my brain is also acting up, and like my feet are also acting up. With those type of doctors, it feels like you have to defend yourself, and you have to constantly defend how your symptoms are connected, and you have to be so strategic about communication. It's almost like you're talking to a lawyer or a banker instead of a doctor. It also, like, the way it costs me is it kind of makes you feel like you're crazy.
Oh, crazy. And following up on that note on miscommunication, how much have you been told outright, as in information you've been provided on your health, and how much have you had to independently uncover?
I would say for my heart condition, a lot of it has been told outright. I can't actually remember how much of it was told outright to me as a child, because a lot of it just went to my parents. But my parents have always been very transparent, open, and they always encouraged me to do my own research. The way everything is connected right now, like now that I'm noticing that everything is connected, all of that is research I've done myself. And honestly, like, this is a whole nother conversation, but I use AI a lot for like my health. I like put in all my symptoms, like head to toe, what I'm feeling, and I'm like, how does all of this relate? And it actually works. Like, don't trust AI, obviously, with making diagnoses and your health information, but like doctors don't take the time to do that level of processing from my experience. So AI will do it if you just tell it to. So it helps.
And with AI, do you feel as if this is a really great tool for a lot of other patients to use in terms of just making sense of everything? Not necessarily diagnosing, but just understanding what these symptoms mean in the context of their diagnosis.
I would say it's been useful for me, but that's because I know how to question AI and challenge AI and know when it's right and wrong and when to use it and not to use it. And like, I don't cross emotional boundaries with AI. I don't like tell it all like these deep things. It's mostly just like very clinical facts about me. So for that reason, it's useful, but I do think like if you're using it, you need to have some level of AI literacy that I don't know if all patients have access to right now.
How does one acquire AI literacy?
For me, it's been through education, like my Duke education, learning from other people. My family is also like super techie, so I've learned through them how to use AI, and I read the news all the time. Everything is open source on YouTube and everything, so TikTok, like, maybe just learn from there first before you use it.
And then on that topic of access, another barrier in terms of like understanding and learning more about your health is definitely insurance.
Yeah.
And so what kind of relationship do you think that you've played with insurance, and how has that affected your health outcomes?
Insurance is so complicated. I never dealt with my own insurance until like maybe 15, 16. I would always overhear my mom like literally beefing it out with the insurance like person, because they always like put such unnecessary codes on everything, don't really translate what those codes mean. And then all of a sudden I go to one neurosurgery appointment for like 20 minutes and the bill is $900. And that's after insurance is applied. Like before, it would have been like $2,000, $3,000. And every surgery, by the way, it's like $70K to do. Yeah, every single surgery to get a pacemaker in, replaced, all of that. It's almost like $80K. I don't even. Yeah, that's before insurance.
Oh my god!
Yeah.
And like they don't even do the surgery right some of the time.
Yeah. This past year, last year, I had 4 surgeries because they didn't do it right the first time, and every single one was 70 to 80K. So without insurance, we would literally be broke, but we do have insurance. Okay. But recently I've had to call insurance myself and do all of that, like negotiation, all of that. I just feel like they're not very receptive to patients, and it's very much like, this is the facts. if you don't like it, go to your doctor and ask what's going on. Like one time I called insurance and asked them why there was a code, and they're like, you need to call your doctor's office and ask. And then the doctor's office is like, we don't know, ask your insurance. So you keep going back and forth. And then when you call the doctor's office, you don't go to the doctor directly, you go to the receptionist, and then the receptionist transfers you to the doctor's secretary. And so you're going constantly in loopholes all the time to get all of this stuff figured out.
And again, even with so many missteps, so many miscommunication, you, through your resilience, through your intelligence, through your emotional ability, are able to navigate these hoops. And so I'm curious, what resources or institutions do you and your family lean on in times of need?
I would honestly have to ask my parents what resources they use. They just do a lot of research on their own. And ask a lot of friends. My family is Indian, and we have such a robust Indian community, and everyone is doctor, lawyer, engineer, all these things. So if you need help, you just lean on your community. But I just cannot imagine. I come from a relatively privileged background. I cannot imagine what it's like for someone who doesn't have this level of resources already. I remember I took a patient activism and advocacy class, and we read about a mom who is a doctor herself who had to fight tooth and nail just to get a surgery approved for her daughter, and she's already in the medical system.
At the start of our year, we all volunteered together at the Ronald McDonald House. That was really sentimental. I know that you mentioned at one point you and your family have leaned on to that resource.
Yeah, I think Ronald McDonald House was a big one when we were in Boston. I was at Boston Children's Hospital, and so we were about 4 or 5 hours away from home, or maybe more than that. I don't know how far it is from New York, but my parents needed a place to stay. My grandparents who were there needed a place to stay, so they stayed at the Ronald McDonald House, and that was so essential for me to get the care I needed because I was there for a while. I'm trying to think what else. Anytime I'm in the hospital, the hospital actually is so equipped with so many resources for families that I don't think, people don't really think about living in the hospital as a full hotel experience, but hospitals have they have chapels, they have dining halls, they have extra rooms for families who are staying there for a long time. So I think honestly, I actually really, I don't enjoy being in the hospital, but the hospital, being around nurses and everything, that's the best. But it is one of the most I don't know, very personal parts of medicine.
Mm-hmm. And from your experience, just speaking candidly, have you felt like you've been able to connect more with the nurses you work with or the doctors, and what would be the separation there?
I would say I'm able to connect more with doctors because I see them a lot more often. Mm-hmm. But when I'm in post-surgery or before surgery, I will have very personal conversations with nurses, and I'll ask them about what their day. I remember I just had a surgery last year in December, and I was choosing which college to go to. So I just asked the nurses how do you choose how do you choose nursing? Why are you a nurse? Things like that. And those kind of feel the more older I get, nurses just kind of feel like your friend. Mm-hmm. But yeah, I feel nurses have always been the anchor. You can't be in the hospital without a nurse. You need a nurse. The nurse is the person who makes you feel safe.
That makes sense. And obviously, in terms of advocacy, you've had to put yourself in lots of situations where that might not be comfortable for you. And you mentioned that for your first step with advocacy, that really started with an email. And so, do you mind explaining a little bit about the email and how you had to put yourself outside of your comfort zone there?
Yeah. So I would actually say my advocacy started a long time before that. I was maybe 6-7 years old when I was doing my own research with my medical condition, bringing that to my teachers, my doctors, everyone, because a lot of times I wouldn't get the accommodations I needed in school. It was a lot better when I lived in New York because they just had a lot more robust support system. I would get physical therapy for free 5 days a week in school. I came from North Carolina, and they were we can't do that for you. so that's, especially when I came to North Carolina, that's when I started fighting with my school a lot, and my parents did it too, obviously. But when I mentioned the email, it's because that's like the first time I ever really took it public. It was after my cardiac arrest in sophomore year of high school. I had a brain injury then, so I went to school in a neck brace, like full like collar neck, like the rigid neck brace, for a week or two. So I had the cardiac arrest, I was at home for a week, then I went back to school with a neck brace, and then I took it off, and even after I took it off, I was still experiencing like numbness throughout my whole body. I was feeling like nerve pain, shooting pain, like things like that. I remember my brain was all over the place because it's just like it had like a really hard hit to my head. So obviously I wasn't like functioning as well, but I didn't have any breaks because I had to catch up on all my work. So any lunch break I had, any like free time I had, I was doing like makeup tests and makeup assignments, and on top of like all the other work I was catching up on. So I was honestly doing more work after my surgery than I was before. I mean, not surgery, cardiac arrest. But the problem was that my teachers thought I was recovered because they couldn't see anything that was going on like internally. And so they, honestly, some of my teachers neglected some of my accommodations, like flexible deadlines and everything. And then one of my teachers gave me C's on a bunch of assignments I actually submitted because I had turned them in late, because I needed to go to sleep that night because I was just like in too much pain. And that like kind of pissed me off. So I like told him, I told the principal, and like nothing really worked. So I went, and then I didn't want to go through the district, so I just like, I was angry in that moment, so I just emailed the Department of Health, North Carolina Department of Health, and I was like, this is my experience. I didn't want like vengeance or anything. Whenever I'm angry, I want to just do like something bigger to like show that I'm better than whatever like people are trying to reduce me to. So like I emailed the Department of Health, and I was like, I want to do this project about students with disabilities, and this is like my way of making something out of this moment of anger. And then that kind of led to a whole project. And then my advisor of that project referred me to this research network, the National Research Network, with a bunch of doctors. And now I'm on their advisory board, and I think in the next week we're about to publish something in the Journal of American Medicine. So
That's amazing.
yeah, technically not allowed to be out loud, but it will be out in a week, yeah.
Well, don't worry. By the time this podcast goes up, it will be out.
Yeah.
So it's all good.
It's very evident that you speak about your advocacy with great honor and prestige, and you see it as a privilege. But I also know that you shared that peers that also have your condition are often not even in a position to be articulate, to be able to do the things that you do. And so I wonder, do you feel obligated to be an advocate, or is it something you really choose, or maybe both?
I think I've always felt obligated to use it for something good. I didn't always feel obligated to talk about my medical experiences publicly and sort of in an advocacy light. That's kind of just something I wanted to do. And then it kind of stuck because like I noticed that a lot of people want to hear it. And so I started talking about it a lot more. Though sometimes I really hate that, like for example, when I got Presidential Scholar last year, a bunch of news outlets contacted me to talk about my story, and the only thing they ever talked about was like my cardiac arrest and my health problems. And like I did so much stuff in high school, I did so much research, I was part of so many clubs, won so many awards, all of that, and I was like, why is none of this being talked about? That's the thing I'm actually proud of, is like doing all of that on top of struggling with all of this. And that was just not the main focus. So sometimes like that I get a little irritated, but like obviously that's a privilege to even be irritated about that one. There's so many other children in the hospital struggling. I think something that does also bother me a little bit about being an advocate and activist, and honestly this is not even the public facing part of it, it's the internal, like the amount of work I had to do last year to give me accommodations that would actually work for me. Like I had to get a lawyer, I had to do documentation every single week. I had to send like emails. It was almost like 3 to 4 hours worth of like writing emails like almost like every other day, to do like all of that work, and like that puts me in a mode of like anger and like fire and all of that, and just like I have to be very persistent, I have to be very articulate, I have to be very strategic, I have to like document everything to a very extensive level, and like I prefer not to be that person. Like in my day-to-day life, I like to be more gentle, I like to be like kinder, softer, and like I don't like conflict. I avoid conflict as much as possible, especially with my friends and like personal relationships and everything. And so to have to be in that mode and fighting all the time, like it messes with your brain, it messes with your head, it messes with your own self-perception of yourself. And it also messes with how other people perceive you, and like it's definitely at times affected how I'm perceived in an academic setting. And it's not like anything I'm able to control because I need those accommodations. Like I can't just not move without them, you know.
How has it impacted how you've been perceived in an academic setting?
I would say like a lot of deans and things like that have heard about it before I even talk to them. So like I meet with deans, and like I met with a dean last year and I was like, I need help with this situation. I think it was academic, and she was like, yeah, I've heard you've been talking to all these people at Duke, and like it always comes with some type of tone and assumption, like, oh, you're the problem kid, you're the problem student, you know what I mean?
Yeah.
So like they can't see me for what I bring academically first, and I think that has also, I mean, in high school it affected a lot of my opportunities. Like I was one of the highest performing students in my class, and I was left out of like special programs and stuff like that because I had like a tense relationship with admin and everything.
And you're not a problem. You're incredible and smart and so fun. And you haven't even mentioned, by the way, Dishita is our VP of Outreach on the DVH team, and you do such wonderful work. I'd love to ask a quick question on something you mentioned earlier about how people can often oversee certain aspects of yourself due to your condition. What do you wish more people knew about you?
I think like one thing I really pride myself on is like my humility. I mean, obviously this whole time I've been talking like really positively about myself just because I want to. I think it's better to talk positive about yourself and show people positivity. But I do like, like empathy is such an important thing to me, is like empathizing with other people's experiences. I don't like to judge people for how they live their life. Like I don't try to make that many opinions, because at the end of the day, like life is so short, and if anyone knows that, it's me. And so like if you're living life in a way that feels good to you, why would I like tell you? Obviously don't hurt anyone, don't like don't be a bigot or whatever, but like I couldn't really care less about how you're living your life, and like that like level of authenticity, and like being genuine and just connecting people with human to human, like that's like my favorite part of just like me and my interactions. And I wish like people saw that side of me before they saw like the angry side or like the side that's always fighting.
And kind of going off of that, when it comes to people actually taking you seriously in terms of the admin at school, the doctors you work with, your classmates, do you feel as if you have to put on a specific type of persona? And what persona is that in order for you to be seen and actually like understood by these people?
I think it really depends on who. Like if I'm talking to admin, I do have to like almost like lean into a very vulnerable side to be like, oh, I am like sort of helpless right now. I'm not helpless, like I know what I'm doing all the time, like I'm always like 2 or 3 steps ahead. But like for admin to care about you, you have to sort of come off as like weak or like in need of help. And so sometimes that's hard for me because I've always been like I've always had a lot of autonomy and like value of autonomy. And so for me to like let my guard down and pretend almost that I need a lot of help and I'm weak, like I feel like I should get help even if I'm not weak. I should be getting help just because I need it, not because like I'm in extreme pain or I'm helpless or something like that. But you kind of have to show that you are to get help from admin. With doctors, I do think I've had to become a lot more vocal than I have been in the past, especially as a child. I'd always let my parents kind of talk, but now that I'm like speaking up for myself, they start listening a lot more. I was like most of my peers just kind of see me at fully, so I never really had that type of problem. Like, I think the good thing about being in such a like academically competitive environment is people do see you for your academic rigor. And whether that's good or bad, like it's very competitive at times, but like at least people do see the intellectual and like that side of me, and like they couldn't really care if I have medical conditions because at the end of the day, like I'm still their competition. So like sometimes that's actually really good.
Exactly. That makes sense. And then also like kind of just going into that, when you were talking about your peers, it seems like you have a lot of really great people by your side. And so just during all of that, how do you feel as if your peers and your family have played like an important role in supporting you?
Yeah, I have really, really good like female friends. I have very good female friendships, and I've had that since I was a young child. And like if I ever am going through anything, I can just text anyone. Like I have like a list of 30 people I could just text at any point of any day and be like, I'm feeling really sad right now, or like I'm really angry, or like this is pissing me off right now. And they will respond and they will be there. And like one friend in particular, when I was having surgery about 2 years ago, like I don't really know where I am with religion right now, but she's Christian. And so like she like held my hand in prayer and everything, and like that was so meaningful to me. I've just always had friends who are so empathetic and caring, and like they will treat me as a whole person, which is so like it's so important for my self-perception and sense of self. And my family has always pushed me to like be extremely strong. They're like, you're strong, you're strong, you're strong, which like sometimes I get annoyed. I'm like, can I just like not be strong for like a day? But like I do appreciate a lot, because like without them I wouldn't be so willing to like stand up for myself and willing to stand my ground, because I know at the end of the day, if I'm angry at someone, they're gonna be angry at the same exact person. You know what I mean? And they're always the ones who tell me to like speak up, be confident, like things like that. And they've just always been there. Every surgery, every cardiac arrest, they're always there. Like I haven't gone to like any singular appointment without my family. So
Looking back on everything from collapsing at the pool at age 2 to being an advocate on the national stage today, what is the deepest truth you've come to about health, care, and yourself?
I would say in terms of health and care, I would say the medical system is more broken than most people like to think or believe. I would say like doctors and hospitals and medicine in general is a little bit glorified, in the sense that everyone assumes that doctors are very empathetic and caring and all of that. And like it's true, but I would also say like at the end of the day, doctors are still there and making a living, and not all of them have been through this level of suffering that their patients have. And so, I mean, even being at Duke and being around pre-meds and everything, like, what's encouraged of them is to understand organic chemistry and biology and, like, do research and not really get into like, the very deep, intimate grieving process, suffering process that patients have to go through. And so I feel like there is a disconnect there. The good thing is that there's like a few main places where healthcare can improve, and I feel like it should improve, which is one, that medicine is very siloed. Like you go to one doctor, and then if you want something else fixed, you have to go to another doctor, you have to go to another hospital. I think there just needs to be a lot more networking, a lot more communication between hospitals, between doctors, between disciplines. Another thing is that patients don't really have the tools to communicate about their own embodied experiences in a clinical way and what's going on in their body in a way that could actually result in clinical outcomes. I think with the rise of AI, there's a lot of ways that AI can be put into that communication system so that patients are more armed with the ability to communicate about what's going on. within themselves. I think those are like the main things. I would also say like insurance and all the profit stuff that might need to, I feel like there needs to be a little bit of separation between private sector and hospitals. But there is room for improvement. I just feel like people need to be realistic about where medicine is at right now and confront it instead of trying to portray it as this very rosy, like saving people, helping people all the time. About myself, I would say, I would say that the biggest thing I've learned is that like there's nothing that can bring me down ever, because as I said before, like having 6 cardiac arrests, they're already beating nature like beyond, like it's literally a miracle. Like sometimes I cannot even believe it myself. And so if I've been through all of that and I've picked myself up every single time, and like even though like my mental health struggles sometimes and I do go through spirals and things like that, at the end of the day, I know that there's going to be like a light at the end of the tunnel. I don't need to see the light before like knowing that I will get myself there and I will pick myself up eventually, and I know I'm capable of the healing and the effort that it takes to get there. So there's not a lot that scares me in terms of what I'm capable of. I can put myself like in most situations and find myself out of it if it's bad. So I trust myself a lot. And I trust also that even after going through so much hardship and having experienced so much pain and even anger towards so many systems, I still lead every single day with so much kindness and maturity and empathy. And I approach every interaction with gentleness and an understanding. And so I know that I prioritize those values and I put them first every time. And like nothing can really stop me. And I don't think like even people who haven't been through so much can say that about themselves. And so like that's something I trust about myself and I value a lot. And it's like it's kind of the source of like my authenticity and genuineness.
As you know, our audience is filled with future doctors, future health policymakers, people who really want to get into the business behind health.
Yeah.
If there's one takeaway that you'd like them to leave this episode with, what would it be?
I would say rely on patients and trust patients. You have to assume that patients are the most intelligent people in the room. Like, I think a lot of people when they go into business, when they're a doctor, you've been through so much training, you assume that you're the expert, that you know what's going on, but you don't. The patients know what's going on better than you could ever know. Better, like, they know what's happening in their body, they know how it feels, they know, like, the senses, everything. And so, don't go into the room assuming you know what product they need, assuming you know what treatment they need. Ask them what they need, get them involved in the innovation process. I just, like, patients are your biggest source of knowledge and information in any type of work that you're doing in the medical field. So just let them lead the conversation, let them lead the work.
Dishita, this is honestly so amazing. I feel like these are the kinds of conversations we need to be having, especially with future doctors, on how to actually interact with patients and make their experience good and make them feel heard. And so I really believe that this is the platform to do it, and I'm really grateful we had this conversation today. So thank you so much.
Thank you for the opportunity.
Thank you.
And for all of you watching, thank you so much for tuning in, and we'll see you next time. Bye-bye.